This is Jerry Hesch from the Hesch Institute in Aurora, Colorado, and this is my client Colleen, who came from LA for treatment. She was basically bedbound since back surgery 18 months ago, and very limited tolerance to activities of daily living. And when she contacted me, I told her I just didn't know if I could help her or not. She was convinced it was her sacroiliac joint, as was one of her pain doctors. And we do have those films, the film of the evaluation treatment posted on my YouTube channel. And she did present with blocked movement throughout her SI joints on both sides. And freeing up that motion brought a dramatic response. And I'll have her tell her story.
Okay, so like you said, I'm from Los Angeles. I had spinal fusion May 3rd of 2018. Was very hopeful that I would do well. I had a great neurosurgeon. Once I got out of surgery, it was almost instantly that I knew it was beyond surgery pain that I was in. I called my doctor about 6 weeks out from the surgery and said, I am in more pain now than what I was the first week. He told me that's impossible. Maybe you're just going to be somebody that needs more time to heal. So I went with it because I trusted him, and as the weeks went on, I was getting worse. I couldn't stand up enough to toast myself a bagel in the morning. I rented a hospital bed that I thought I would only have for maybe 4 or 5 weeks. Well, I kept it for 4 months. My fiance had to help me get out of the hospital bed. I just was in excruciating nerve pain, a ton of pressure in my back. It just felt like it wanted to explode. So I carried on for quite a while, not having any answers. My neurosurgeon basically saying maybe I'm just a person that needs more time to heal. So he did actually send me to a colleague of his 4 months out from the surgery. I had no fusion yet. There was no bone that was growing, and that orthopedic told me that I can either wait the full year to fuse, or he believed right then and there at 4 months that he needed to redo the surgery, go in through my stomach, and redo it completely, because at 4 months I had no fusion growing whatsoever. So that was pretty difficult news to hear. I decided to wait. I didn't fuse until the 10th month. I showed a great improvement between like a 2-month period. But again, at 10 months, I could not stand, I could not sit to eat my dinner. I had to lay down almost completely flat. So that went on for the full year. So after a year and 1 month, I went back to my neurosurgeon and I said, okay, I am in worse pain than what I was before the surgery. I physically cannot do anything. So we went forward with removing my hardware. They said your body just must be rejecting the hardware. Even though my scans looked perfect, the hardware was intact, nothing was loose. And in fact, he welcomed other opinions. I got 5 other opinions with top surgeons at University of Michigan, and they said everything's fine, there's nothing further that can be done. That maybe I was one of the ones that just had, bad luck. So June of 2019, we went forward with taking the hardware out. I was hopeful that that was the answer, and week after week after week, again, I kept getting worse and worse and worse, to the point that I couldn't even walk my dog outside. Same pains I was describing for the whole year. Pressure in my legs, extreme nerve pain. I was walking just hunched over to try to take the pressure off my back. But as well, I kept explaining to my neurosurgeon that right under my incision is where it hurt the most, without even knowing what SI joints were. He kept just shrugging his shoulders. He had no idea. To rewind a little bit, my pain management in Michigan, 5 months out from the surgery, told me that it's not my hardware, that in fact it's going to be an SI joint dysfunction, that I should get some steroid shots to see, or diagnostic shots. I called my surgeon up and I said, this is what he thinks. He thinks it's not my hardware, that it is my SI joints. And my surgeon said that's probably only 10%. That's not the case.
10% of your pain.
Mm-hmm. He said, so if you decide to do the shots, it's only going to help you 10%. So at that point, I thought, why am I going to go into another invasive surgery with no great outcome? So I decided to skip that and went forward with taking the hardware out in June, and June of 2019, and I just got worse and worse and worse to the point that I was spending 22 hours a day in the bed.
And this is now March. We're now in March of 2020, just to
Right.
let the viewer understand.
Right. So again, the last time I saw my neurosurgeon was this past November of 2019. He wanted to send me to a ketamine specialist for the pain. He pushed me off to pain management as well. Pain management didn't even give me a thorough exam. He instantly told me it was scar tissue and that I would need a spinal cord stimulator put in my back. I didn't want to accept that as my fate. I knew the pain had to be coming from somewhere, and after researching scar tissue, there was no great evidence that that would be the issue for all that pain. And also because of my walk, I was wobbling. It felt that something wasn't in the right place. I kept explaining to my pain management, to my surgeons, it feels like there's two bones that are together that shouldn't be. Something is giving me a ton of pressure, and I kept asking, is it my fusion? Am I just doomed the rest of my life, and it's my body saying I hate where I'm placed right now because there's two bones that don't belong together? And I felt that. And my pain management sent me to a psychologist that convinced me that I was a failed fusion, or trying to convince me that I was a failed fusion, that I had to come to the terms that I needed a spinal cord stimulator to get back to work and get on with my life, and that I need to come to grips with the fact that nobody can figure it out and this just happens. And that day with her, I said, please cancel my next appointments. I don't want the spinal cord stimulator. If it's going to take me more months to figure it out, I've gone this far, I need to keep researching. So a friend of mine said you should join a group on Facebook to see if you can get some answers. So in November I did. I started with a SI joint dysfunction group. It had 9,000 members, and I started to see Jerry's name pop up here and there. But again, I knew nothing about SI joint dysfunction. I just was clueless. So I was reading 10 plus hours a day on what is wrong with me. There was another lady that really spent some time with me, private messaging me about her experience with Dr. Jerry Hesch, and she had great results. And she was also bedridden like me for 18 months. So after speaking with her, I said I need to research him and figure out his methods. After watching numerous videos of him with other patients, after reading about his credentials and what he was about, I really felt that he could help me figure it out. So I called him. He answered the phone right away. He was very kind. And in fact, he didn't know if he could treat me or not. But I didn't let that discourage me. Without meeting him, I felt really confident that I believed he could. I had every symptom of SI joint dysfunction, including going to the bathroom 10 times an hour, which has now completely subsided. So this is my third appointment with Dr. Jerry Hesch. I have to say, I woke up this morning with 80% less pain Yesterday I woke up with about 60% less pain. So I feel great. I don't walk with a wobble anymore. My nerve pain in my legs is nothing like it was before. In fact, it feels like a different nerve pain, like my body's tingling and trying to wake up. My pressure is 80% less in my lower back, which I feel confident is going to subside through continuous stretching and things that I need to do to heal myself. I used to press on my back, and I used to tell my fiance that there's something sticking out, and I would try to push it in, and I would say, this is not my back. I know my body, and this is not my back. So yeah, this is my third appointment, and Dr. Hesch really took his time with me, and basically, I can't use the lingo you do, but basically put my pelvis back in place. And if I ever attempted to do anything, like go to the grocery store just to get out of the house, or I made a good friend of mine a Christmas arrangement of flowers, I was bawling my eyes out for 3 days after that because I felt so much muscle tension and pain that would travel up my back, and just it felt like somebody poured cement over my entire back. And Jerry found, I think, a rib that was twisted.
Yes, rib number 6 was, it had blocked distraction mobility. All the other ribs, I could distract them slightly and spring them, and that one I could not. I could spring it in towards your spine, so it seemed like with a twisting injury, that rib got stuck within its normal range of inward rotation towards the spine.
I felt that. I mean, as soon as he even gently touched me right there, it was extremely tender. I kept telling my fiance, my lower back is ridiculous, and now my upper back is just feeling so much pain and muscle spasms as well, and I guess that was the cement feeling. I was texting a friend last night, and I was telling her that the muscle spasms and the cement feeling was debilitating on its own, never mind the rest of the symptoms. And as I was texting her last night, I got butterflies in my stomach and chills, knowing that my muscle spasms are like 90%, 85-90% just gone. So I do believe once I strengthen myself, I'm on my way to healing. And in just 3 sessions, I went to 15 different surgeons, 8 different physical therapists. I exhausted everything, acupuncture. I was going to get massages regularly. Everything escalated my pain. None of the PTs told me anything about SI joints. They were actually even pressing on my lower back because I would tell them that's where my pain is coming from, and not one of the PTs could recognize that my pelvis was twisted or moved forward.
Now that's a very important point, and I want to add that I can't validate that I put anything back in place. What I can say is that you had blocked mobility in several directions of your pelvis, in which it looked like a pattern of bilateral upslip ilium. I couldn't get passive movement through the pelvis on either side going downward, and also blocked in terms of posterior rotation. We don't fully understand this problem, but the passive spring testing is what guided my treatment. It had nothing to do with alignment. Your pelvis looked perfectly aligned. There was symmetry from side to side. A lot of people think if the pelvis is asymmetrical, that means the ilium rotated on the sacrum and got stuck. But that's kind of crazy because the whole pelvis can move on the hip joints and become stuck in a asymmetrical pattern. But you had symmetry of your pelvis, but you had blocked mobility. So it was a restoration of mobility is what I did.
And that was pushing down on my sacrum as well. Right, the pelvis was
Right,
pushing on
I
my
mean, to the
sacrum.
best of our understanding, it's an incomplete model. There's very limited research on this particular pattern. It is what it is, but you're better, and it shows in your case the value of doing the passive spring test. And there's YouTube videos I posted on that. So
Yeah.
searching my last name and the word spring test will show you what those are. And my last name is spelled H-E-S like Sam, C-H, and I share trade secrets. I put the information out there for other clinicians if they are interested.
Yeah. So I have to say that, we came, like I said, from Los Angeles. We traveled in the car for 20 hours with no break to get here. Got to the hotel, showered, and came right here. And it's pretty amazing what just happened these last 3 days after exhausting literally everything I possibly could.
And of course, today I get to treat you how to keep that motion.
Right. I did my exercises
Nice.
last night.
We did start that. We did start teaching you yesterday.
Yeah, so I did my
Nice.
exercises last night. Didn't do them this morning yet, but I will when I go back. And
They're a distinct departure from like the muscle energy self-alignment techniques. These are different
Right.
for a variety of reasons. I've also explained that on some of my YouTube videos.
Right.
So you could look up anterior ilium treatment with my last name and find out where I explain why it's different, why that matters, how you do it, why hugging your knee towards your chest, doing isometrics does not work.
Yeah, that's
Anyway.
what every PT taught me.
Right,
so
right. Yep.
I just,
yep.
I have to say that I highly recommend seeing Dr. Jerry Hesch, and I am so grateful that I was able to come here. And, it's emotional after all this time of being stuck in a bed with no answers. I have not met a physical therapist or a neurosurgeon or an orthopedic who is as caring and compassionate that you've been. And I want to thank you for that.
Certainly. Yeah. Brian, do you want to add anything?
Just echo what she just said, actually.
And I don't know if you want your face in the video or not,
Yeah.
so that's a no?
That's a no.
Alrighty, okay, so we'll just show my grandchildren. I have a home office, so
Just echoing what she's been saying, and from the beginning, it seems to be the issue with a lot of these surgeons is if the patient isn't out of pain right away, it's a failed fusion, and they don't know the entire biomechanics that Dr. Jerry Hesch knows. And it's sad that a lot of people put their trust into these doctors to fix them, and once their particular surgery that they are specializing in supposedly is finished, they don't want to take responsibility or to help figure out what exactly is wrong when the patient is telling them exactly what's going on. They just don't know what to do with it. They don't know what to do with that information. And like she said, from the time she reached out to Dr. Hesch, he's been very responsive, very informative. He has tons of videos. We've watched so many of them, and everything that we were hoping for has happened. And now it's going to be up to Colleen to continue what he's teaching her. And I think things are looking very hopeful right now, thanks to Dr. Hesch.
what have you noticed? What's the biggest difference you've noticed in the last 3 days?
The most amazing thing, and it happened pretty rapidly, is her walk. She was, I don't want to say unable to walk. She's a strong woman, and when she had to, she did, but she was very slow, had a wobble, would always hunch over. If she did go out with me anywhere, as much as I would be conscious of it, I sometimes would have to slow down a little bit. And since the first session, she's walking like she used to, and each technique he was doing on her was adding to it. And by the end of yesterday's session, she was almost walking normally like she's always been, and you could totally see it. And today, walking to the car to come for our last session, she was about 8 yards ahead of me. and I'm a fast walker. I'm known to be a fast walker, and she was 8 yards ahead of me, and I just didn't say anything, just enjoyed seeing her walking ahead of me.
Very good. Anything else?
I am just thrilled. I got my life back. I got my life back. I'm up for the challenge of continuing to do my exercises. He's going to show me everything today, so I, have it for myself. And I went from 20 months bedridden, not going anywhere, to I have my life back now. And I will only continue to get stronger, and I'm just excited. I can eventually go back to work. I had to close down my hair salon, and that was very heartbreaking for me. And like I said, the most frustrating part is not having any answers. All these surgeons have all this education, and they can't even understand the biomechanics of the body like Jerry Hesch does. So I highly, highly recommend anybody seeing him, no matter how hard the travel is. Do whatever you can to figure it out to get here, because I don't think there's anybody else like him out there.
And I also teach workshops. Just had one canceled in Chicago. We had 72 people scheduled for next week, and this virus put the kibosh on that. It's been rescheduled for June, but I'm doing my efforts to get this approach out there. It's a distinct departure from the traditional muscle energy technique people learn for the pelvis, for treating the pelvis. Wrote a book. It's 320 pages, a couple of book chapters, a couple of papers, presentations at conferences. I'm trying to do my part. I'm just one person.
Wow.
But hopefully others will help, help bring this work forward. We certainly need research to demonstrate what it does and what it doesn't do. Anyway, I thank you for sharing your story. I'm so pleased, because I was truly very concerned about whether or not I would be able to help you. And it certainly is interesting that you have a solid fusion, but you also had blocked mobility through the pelvis. I said pelvis. I didn't say sacroiliac. I said pelvis. And that restoring that normal movement, every joint, you should be able to stabilize one bone, move the other bone, that's called taking up the slack, to where it stops, and then give a little thrust, and it should move and recoil. And in several directions, you didn't have that movement.
I felt it. When
Same
you did
for your
that.
rib, and we restored those movements, and it had a very profound impact on your pain, reducing it and restoring normal function. So I think those spring recoil tests, have a tremendous amount of value.
Absolutely.
And thanks so much.
Yeah, thank you, Jerry. Thank you.